Now, it's interesting that high blood pressure has grown
Correct.
by literally 100% over the last 15 to 20 years.
Absolutely.
Totally related to our lifestyles, stresses, etc., and many other factors. But the important aspect is that the public needs to understand that it is the biggest cause of all the killers that we have in our society, is the biggest cause of it. And we need to define, detect, and control it. That's what's high blood pressure all about. So that, can you believe that if the blood pressure is 10 millimeters up, what happens is that you increase your chances of stroke by 20%.
Okay.
Every 10 millimeter increase in blood pressure, we're increasing our chances of stroke by 20%. Chances of bleed in the brain by 30%.
So we talk about stroke as being one of the most prominent factors whenever we talk about resistant hypertension, and it's one of those terms that are being thrown around on the crossroads, like throwing your visiting cards at this point of time. With the advent of technology, with how people are actually living their lives, lifestyle has a big role in it. And stroke being one of the most prominent factors. So can you shed some light upon this particular condition that is affiliated with resistant hypertension?
Yeah, I think it's associated with high blood pressure anyway, with hypertension anyway. But of course, resistant hypertension leads to far more increase in the chances of stroke, that's what I've said. So what is a stroke? Stroke is a very debilitating condition. Public understands stroke as a hemiplegia. A side of the body stops moving, speech. But what causes it is either a clot in the brain or a bleeding in the brain. And when that happens, obviously the brain stops functioning.
Second myth that I want you to debunk, doctor, is it's all about diet and exercise.
It's diet and exercise is very important. There's no question around that. But it's not all about diet and exercise. High blood pressure is also a process of the body due to many reasons. And it actually, therefore, is due to the blood vessels getting really, stiffer. It's to do with numerous aspects of kidney, arteries, kidney itself, the sympathetic nervous system. It is a multiple pathophysiology around high blood pressure. So diet and exercise is only a part of the lifestyle which may influence blood pressure by 10 to 15 millimeters.
Okay.
But the rest of it is an inner system of sympathetic drives and nerves, stiffness of the blood vessels, and therefore a whole conundrum which therefore creates resistant hypertension. And that's why we say, let's make sure that we treat it as a whole rather than just with one or two interventions, as we say.